So, welcome, Dr. Irene Oldfather, and thank you for making the time to come and speak with us today, reflecting on 25 years of achievement in the Scottish Parliament. But you were in there right at the beginning. What was that like?
Well, thank you, first of all, Sheila, for inviting me. It's an absolute pleasure to be here. And as you know, throughout my time in Parliament and since then as well, I've been so supportive of the work that Ash Scotland do. So thank you for doing this reflection around important points in the Parliament's history. And yes, I was very fortunate to be one of the first members in '99 of the Scottish Parliament, and actually a member of the Health Committee at that time. And just reflecting on coming along today, I was thinking about one of our early meetings where we talked about what would be our public health priorities as a parliament going forward, and people contributed different ideas and so on. One of the things that I contributed, and Hugh Henry also from the Labour Party supported, was the idea maybe we need to think about banning smoking in public places. And I have to say, in '99, that was quite controversial, and I hadn't actually realised at the time just how controversial it was until I went home that night and saw Hugh Henry and I on the evening news, and MSPs want to ban smoking. And then I started getting a few phone calls because I was in a very traditional West of Scotland constituency where this was very, very different and new thinking, and people were saying, what are you doing? Are you trying to make the Labour Party unpopular? I said, no, I'm trying to get a public health agenda that young people can sign up to, and that actually is modern and saves people's lives. And one of the reasons I did that, Sheila, was because I had taught at the University of Arizona for a couple of years, and so lived in an environment where smoking was banned in public places. So you could go to the cinema, go to a restaurant, have a drink in a bar, and there was no smoking. And having lived in that environment for 2 years and coming back to Scotland and having a history of asthma as a child myself, I found it very, very difficult and quite a transition to make. And I thought, why are we still doing this? What's the public health evidence around it? And can we in Scotland have a debate, a discussion about this? Because at that time it didn't feel like enough people were talking about it. So so from there, and that very difficult time, I think, just trying to explain to people what the advantages of this could be. I mean, there we were years later introducing the smoking ban, which I don't have to tell you, has had an amazing impact on people's health outcomes, and I feel hugely privileged to have been a part of that, and also the cross-party group, of course. I was convener at one point and vice convener, I think, when the legislation was going through Parliament, and it was really nice to be able to work and cooperate through the cross-party group with colleagues in other political parties, and Stuart Maxwell was the convener at one point, and we had a very good working relationship, and to bring that sort of consensus approach, which I think was what the Parliament was about. And I think it's what the people of Scotland wanted to see in the Parliament. Politicians working together and moving away from that very adversarial Westminster kind of male-dominated approach to politics, into something that was a bit more about communities, about people, and particularly about young people. So I think all in all, the cross-party group was actually one of the groups that I think illustrated the strengths of the Parliament, because it was one of the first groups to bring together that consensus in what was quite a tough and challenging era. Even to the time when the legislation was going through Parliament, you'll know that some of the pub owners associations and so on, the restaurant associations were saying, oh, you're gonna kill our trade, this is going to be terrible, and with terrible stories about gloom and doom and all the awful things that would happen, and actually they haven't happened. And what we have seen are these huge public health benefits, and for me is a great demonstration of what the Scottish Parliament contributed to our communities and our society, and that working together with others across the political divide made that happen, because it took time and it took patience and it took a lot of engaging with people and communities, but those of us who are very committed to the work were all out doing that, and bringing new ideas into our political parties about public health, about diet, about the social determinants of health and well-being. And so in a sense, maybe we were in the right place at the right time, but I do think there was a lot of that genuine collaboration and collaborative working that helped us achieve and reach that outcome.
Absolutely, yeah. So I think probably there was so much potential in those early days of Parliament. And as you say, the smoking ban realised some of that potential to make a difference. And the collaborative working, as you say, I think was absolutely key to it. Where are we, do you think, with devolution and health? What could the Scottish Parliament look to do going forward?
Well, I mean, a very interesting question, but I think all of the things that made the ban on smoking work are there and they're in place. And so that collaboration across political parties is still able to be achieved. And there are some big... We also know a lot more about the social determinants of health, and that sort of preventative, proactive agenda, I can see in areas like inequalities, and actually women's health issues, access to health. There are some big challenges ahead for us with tight resources in a very intensive demand climate for healthcare. So I do think there is something about people working together and finding solutions instead of that very adversarial kind of political approach that we see in other places. And I think there are opportunities and possibilities in Scotland to move forward. And I think that's what people and communities want. They want to see politicians coming together to resolve issues on things like waiting lists, on access to healthcare, on prevention. And I think particularly in the area of health, people feel we should rise above some of the politics and come together. So hopefully the opportunities are there. It's always difficult when elections are coming up because, people tend to focus on the differences rather than the working together. But hopefully, as we move forward, particularly in the next couple of years, and thinking about the ban on smoking that's coming from Westminster and so on, that there are areas where we can continue to work together and collaborate for the benefit of the health of Scotland and the UK.
Mm-hmm. So you're now working in the third sector. You were in Parliament, influencing it, having an impact. You're now influencing from the outside. Is it very different?
Do you know, in many ways it's not really all that different. Because if you're a good constituency MSP, as most MSPs are, you're in your constituency, you're talking to people in communities, and the third sector represent those people in communities. So I guess we feel we're very in touch with the grassroots and health inequalities and the challenges that people have to face with poverty and child poverty in particular. So I think MSPs, and particularly in Scotland, where there is that transparency, accountability, and geographic connectedness, I think. You know, it's not very easy for schools to go to Westminster these days, but they can come to Edinburgh. And so I think it's an open Parliament where visitors are very much welcomed. They can see how the Parliament works. And so that kind of openness between communities, the third sector, and politicians. And again, the cross-party groups are about inviting the third sector in and people and communities in. So, you know, it operates, I think, has the potential to operate in a very open and transparent way that can actually make a difference. And I think the cross-party groups really are one of the kind of engine rooms of the Parliament that can make that happen. Now they don't all work as successfully as the substance misuse one, but you know, they do all have the opportunity, I think, to bring communities in and to hear firsthand the views of experts by experience, which I think the third sector would be very good at doing.
The early days of Parliament 25 years ago, full of potential, full of excitement, full of new possibilities. And now 25 years down the line, we still have devolved powers for health. What would you see as the prospects for those devolved powers for Scotland? What can we do with them?
Well, that's a very challenging question, but I think involving people and communities and taking a very, very intensive look at the public health agenda, because we can't keep doing things the same way. We know that, you know, our waiting lists are getting longer, access to health is getting more difficult, so that prevention space becomes more and more important as we look to the future, I think, Sheila. So, you know, what do we do in that preventative space, and how can we, working together, make it happen? And I think for the future, that's the way we have to go, because the system's creaking a little bit just now. I know that from my work at the Alliance. In terms of people with long-term conditions, chronic pain, it's very difficult often to access services. So, you know, how do we get upstream and early, and how do we agree priorities? And I think self-management's a little bit about that as well. You know, the whole realistic medicine agenda about involving people in their own health and well-being is really important. And I think, you know, seeing them as key partners, because they are the experts in their own health. And for GPs and clinicians to understand that this is a partnership. It's not about telling someone, you know, and doing things to them. It's about working in partnership with them. And I think there is a little bit of space going forward to make sure that realistic medicine agenda, where people are equal partners and in charge of their own health, is going to be really important, and marrying that up to some systemic work around prevention and population health, where we work together. And actually also, you know, I suppose the third element of that is instead of taking people to services, taking services to people and making things available where people are at. And there are some very good examples of that. There's a project in Aberdeen, for example, which has a lunch club. And you know, there's advice given at the lunch club to older people. They can have a blood pressure check. So a very good example of taking services to people in that population health agenda, where, you know, some older people might think, oh, I don't need to go to the doctor. Actually, it could identify high blood pressure and so on, give people advice about diet and you know, health and exercise, because we know that diet, physical activity, all of these things play a huge part in keeping well and avoiding things like diabetes, cardiovascular, lung diseases. So I think for me there is a bit of space going forward to work together on that population health prevention agenda, and, you know, making people equal partners, and supporting them and encouraging them to ask questions and to be mindful and monitor their own health and well-being.
So it sounds like the strengths of the Scottish Parliament and those surrounding it are collaboration and having a vision for going forward and really making it about the well-being and health of the people of Scotland. is it?
Absolutely. And I think the third sector has had a huge role to play in that development. I mean, the principles of realistic medicine are things that third sector were talking about 10 years ago. In the Health and Social Care Alliance, we had a publication called Go On Yourself, which was about, how do you get involved in self-management of your own condition, and how do you ask the appropriate questions, and how do you, make sure you get access to the information that you need. And nowadays we think of things like the What Matters to You framework. Instead of asking people what's the matter with you, we ask what matters to you. And that's all part of realistic medicine. It's maybe kind of the third sector language, but it really is all part of the realistic medicine agenda. And I think that collaboration between the Parliament, MSPs, communities, cross-party groups, and people themselves has worked to the benefits. But we need leadership. That's the other thing we need in all of this, some strong and courageous leadership. And I think, when we see that and we bring all of this together, then hopefully in 25 years' time, we'll be looking back and saying, well, we did the right things around population health, and we see continued benefits to health and well-being. I mean, we never used to think about things like physical activity as one of the kind of antidotes to cardiovascular disease. And we used to think about prescriptions and pills. And I think now people are becoming more aware of their rights in relation to health, of the social prescribing agenda. And, I think Parliament is acknowledging that, because we just can't keep doing the same things in the same way.
That sounds like a great manifesto for the future. Thank you for your time, Irene. Thank you for sharing your reflections and your experience with us.
Thank you for inviting me, Sheila. It's been a pleasure to be here.